আমি আজকে আমার ভিডিওটা অফ রেখেছি, তোমাদের অডিওগুলো অন রেখেছি, কাজে একসাথে একজনের বেশি কথা বলবে না। এখানে দুইটা জিনিস সম্পর্ক হলো সেম কেস স্পেসিমেন অ্যান্ড সেম কেস লং কেস। যে ইউ সি এটা পরীক্ষা ইট ইজ এ কমন কেস, এবং এখানে স্পেসিমেনে give actually both the pictures, both the sides, side by side, the cut surface and the skin surface. Usually two pictures are given side by side. In the one picture you'll see this skin surface and this the cut surface. So what are the questions usually the moderator sets? There are some common discussion, so I'll go to the long case after a short discussion about the specimen. So write down the name of the specimen. It is a resected specimen of breast, or in other words you can write it is a specimen of mastectomy. Both of them are correct, and usually 0.5 marks will be allocated for this question. So you write down just in one sentence, this is a resected specimen of breast, or it is a mastectomy specimen. Then what are the abnormalities you can see in this specimen? So if you go to the cut surface and to the skin surface, you have to write down. So the examiner will put 3 or 4, he'll ask for 3 or 4 findings. On the cut on the skin surface, you can see there is a huge tumor occupying almost whole of the breast. The nipple is retracted and there is pudorine change. These are the 3 findings you can see on the skin surface. And on the cut surface, there is a huge tumor occupying the whole of the breast, and it is homogeneous in color. A homogeneous huge tumor occupying the whole of the breast. That depends on how many findings the examiner will set in the question. And definitely if he asks for 2 questions, he will write down all the 4 or 5 findings, and in the answer key he will write either 2 or 3 of the following 4 answers or 5 answers. Next question, the other skin surface on the cards, what you can see. Write down the symptoms and signs, maybe 1 or 2 symptoms or 1 or 2 signs you will ask for in the question the patient will present with. So here the symptom will be a mass or lump in the breast, and other symptom there may be pain, or there may be discharge through the nipple, and there may be swelling in the armpit or in the axilla. So these are the symptoms. Patient will definitely, or in addition, if you can write down the symptoms or secondaries, patient may have loss of appetite, may have abdominal mass, abdominal distension, may have chest pain, cough, hemoptysis, patient may have back pain or bone pain. So all these symptoms will be there. So you'll find the examiner will put some of the question symptoms and some of the signs. You may ask for 2 or 3 or 4 or 5 symptoms, and 1 or 2 or 3 or 4 signs may be there. And that depending on the mark allocation, you have to, but in the examiner, in the answer key, he will write down all the symptoms and all the signs, and will definitely give the instruction that 4 or 5 symptoms or 4, 2 or 3 signs out of the following all the signs and symptoms. So the symptoms you consider initially, there will be a lump, there may be pain in the late case, there may be swelling in the axilla, and for the secondaries, patient may have abdominal pain, patient may have abdominal distension, loss of appetite, or abdominal mass. That means if there is liver mets, loss of appetite, peritoneal mets, there will be ascites, abdominal distension, and if there is a Crockenbach tumor, there will be abdominal mass. So if there is bone metastasis, there will be back pain or bone pain. If there is lung metastasis, patient may have chest pain, cough, hemoptysis, and if there is brain metastasis, which may have fainting attack or stroke. So all are the symptoms, and signs will be abdominal breast lump, a lump in the breast, there is nipple retraction, there is pudorine change, and here you can see these all these things, all these changes are there. Pudorine change, nipple retraction, lump in the breast, nipple and on the examination of the axilla, There will be palpable axillary lymph nodes or supraclavicular lymph nodes. Patient may have palpable liver, patient may have ascites, may have Procampectomy or abdominal mass. So all these things the patient may present with. So you will write the answer depending how many answers the examiner wants in the question. Then the question may be write down 3 routes or 2 or 1 routes and sites of metastasis of the disease. So this is a carcinoma breast from the appearance. So if the examiner asks what is your diagnosis, the diagnosis will be carcinoma breast. Then next question could be why write down the points in favor of a diagnosis. There is a big mass, there is nipple retraction, or big lump, there is nipple retraction, and there is pure urine change. So these 3 things are in favor of your diagnosis to diagnose a case of carcinoma breast in this particular specimen. You write 3 routes and sites of metastasis. Write down first route is lymphatic, and it will go to the axillary lymph node, supraclavicular lymph node, intermammary lymph node. And then the blood-borne metastasis is to go to the lung, it will go to the liver, it will go to the bone or brain. Then transperitoneal metastasis, it will cause ascites or it will cause Procampectomy. So these are the answers. So if the questions like this, give the answer categorically by 3 routes. So write down investigations, diagnosis, investigation for staging. And he asked for some number of investigation for diagnosis and investigation for. So diagnosis for investigation for diagnosis, here it will be no need to write down the ultrasound or mammography is because it's a huge tumor. But here to confirm your diagnosis, you can do a FNAC and then true cut biopsy. And for investigation for staging will be chest X-ray, ultrasound abdomen, and bone for bone metastasis. So you can write down like this: to see the chest metastasis, chest X-ray, or lung metastasis, chest X-ray; liver or peritoneal metastasis, ultrasound scan of the abdomen; and to see the bone metastasis, the X-ray of the bone or a bone whole body bone scan. Then write down the treatment options for this patient. Here, the treatment option is যদি যায়, then what are the options? Options means there are 4 options. The surgery, radiotherapy, chemotherapy, and hormone therapy. No need to write the immunotherapy. Then surgery for the breast and for the axilla. So here, again, the answer will depend how many points or how many answers the examiner wants in this particular question. So for the breast surgery, breast conserving surgery means wide local excision or quadrantectomy and mastectomy. For axilla, maybe a sentinel node biopsy or axillary clearance. Then radiotherapy. Radiotherapy may be to the remaining breast if you do a breast conserving surgery, and to the lymph nodes. If you remove the axillary lymph nodes, then to the supraclavicular internal mammary nodes. And if the axillary nodes are not removed but it is positive, then the triangular field involving the supraclavicular, axillary, and internal mammary nodes. And chemotherapy may be an adjuvant chemotherapy, or it may be a neoadjuvant therapy. এটা তোমরা ভালো করে জানো, what are the neoadjuvant, what are the adjuvant chemotherapy. The surgery is done, then give the radiotherapy, then it is adjuvant. And you start the radiochemotherapy before surgery to reduce the size of the tumor, then it is neoadjuvant, and 3 or 4 cycles are given before the surgery, and rest of the treatment chemotherapy given after the surgery, and the rest will be adjuvant therapy. And hormone therapy, if the estrogen receptor is positive, then tamoxifen, and if the HER2 receptor is positive, then the Herceptin or trastuzumab. So this is a monoclonal antibody. The hormone therapy, 2 types of hormone therapy is given. If estrogen receptor or positive, ERP are positive, then tamoxifen, and if the HER2 mu positive, then the Herceptin or trastuzumab. So this much about the specimen, এবং এই আনসারগুলি তোমাকে লিখতে হবে depending on how many questions is asked there. Next আমরা এইরকম একটা কেস যদি লং কেস হিসেবে থাকে তাহলে আমরা কিভাবে যাব।
সার্জারি অপশনগুলো আরেকবার একটু বলবেন।
Surgery option, surgery for breast and surgery for axilla. For breast, what we can do, we can preserve the breast or we can remove the breast. If you want to preserve the breast, there are two options. One is breast conserving surgery. There are two options. You can do wide local excision. That means 1 centimeter healthy tissue around the whole tumor. And এখানে criteria হলো that tumor should be periphery, breasted size বড় হতে হবে, and the size of the tumor must be less than 4 centimeter. 4 centimeter ছোট হতে হবে। এবার আসছে বোধহয় না, দেখা যাচ্ছে স্ক্রিন?
জি স্যার।
4 সেন্টিমিটার ছোট হতে হবে, পেরিফেরিতে থাকতে হবে, ব্রেস্টের সাইজ বড় হতে হবে, অ্যান্ড 1 centimeter margin নিয়ে, healthy margin নিয়ে ফেলতে হবে, এবং frozen sexual facilities should be available, and post-operative radiotherapy should be given to the rest of the breast tissue. আর হলো quadrantectomy, you can remove the quadrant. আর হলো তোমার you can remove the whole breast, that means in the form of mastectomy. It হলো axilla surgery, breast surgery. To the axilla, you can do a sentinel node biopsy, or you can remove the lymph nodes, that means axillary dissection. And chemotherapy may be reversible adjuvant or adjuvant. Radiotherapy to the breast and to the lymph nodes. To the breast, if you keep the breast, that means breast conserving surgery. After breast conserving surgery, to the rest of the breast tissue, you can give the radiotherapy. And to the breast and to the axilla, if you don't remove the axillary lymph nodes, but if it is positive, and if you remove the axillary lymph nodes, then radiotherapy to the supraclavicular and internal lymph nodes. And about the hormone therapy, two types. One is if HER2 positive and ERPR positive. ERPR positive হলে tamoxifen, HER2 positive যদি হয় তখন Herceptin. In short, এটাই হলো ট্রিটমেন্ট অপশন গুলো। নাও দি এখন এইরকম একটা কেস যদি পরীক্ষায় ডেফিনেটলি একটা বা দুইটা কেস, মোস্ট অফ দ্য টাইম 2 or 3 cases of carcinoma of breast is given in the long case. আমি এখানে একটা সিনারিও লিখলাম যে কেস সামারিটা তোমরা কিভাবে বলবে, বা তোমার ওই যে যেটা আগে বলছিলাম যে examiner may ask you to present your case, or examiner, some of the examiners who do hurry during examination, they straight away they go to ask you, they tell me your diagnosis. Now why it is your diagnosis, tell me the symptoms and signs in favor of your diagnosis. So usually the method is the examiner will ask you to present your case or tell me the salient feature. So this is the scenario. Mrs. X, a 42-year-old lady, a housewife hailing from the neighborhood, presented with a lump in her left breast for 6 months, blood stain discharged from her left nipple for 1 month. Then the patient states that she was all right 6 months ago. Since then, she developed a lump in her left breast. The lump was small in size and painless and was slowly increasing in size. For the last 1 month, she also developed blood stain discharge from her left nipple. The discharge was spontaneous and is coming out through a single opening. She doesn't have cough, chest pain, hemoptysis. She does not complain of bone pain, back pain, does not have chest pain or shortness of breath. She does not complain of loss of appetite, abdominal pain or abdominal mass, and does not have history of headache, fainting attack or stroke. Therefore, this is actually the systematic direct question about lung metastasis, about bone metastasis, about abdominal or liver or peritoneal metastasis, and brain metastasis. Then the patient does not have history of lump in any of her breast or anywhere in her body in the past. She did not give history of any serious illness or any operation before. She does not have hypertension, bronchial asthma, or diabetes mellitus. এখানে গেল past history and the concomitant medical history. Her menarche was at the age of 12 years, and now her menstrual habit is normal. Her medical cycle is normal. She has 3 children, and all of them she breastfed. none of her first degree female relatives have breast lump. এখানে সরাসরি এক কথাই বলে দাও, similar type of disease না বলে breast lump বলে। She took oral contraceptive pill for a long time and she did not give any other significant drug history, or she is not allergic to any drug. She does not smoke tobacco, but she is a bitter lip chewer and takes non-smoke tobacco. So on examination, she is ill looking. যদি ill looking হয়, অনেক সময় patient খুব ভালোই বসে থাকে, don't say ill looking. The patient is normal থেকে, she is okay, or she is normal looking, and average body build, average nutrition, cooperative and decubitation choice. And she is not anemic. আমি এটা লিখে নেই। General examination finding যা যা আসার এগুলো general examination finding গুলো লিখে দিবে। So here এখানে হলো general examination all findings এগুলো normal লিখে গেলাম। And শুধু একটা abnormality পাওয়া গেছে in the general examination, সেটা হলো the patient has enlarged axillary lymph node, or left axillary lymph nodes are palpable, but you will not go into detail. যদি এখানে examiner পরীক্ষার সময় বলতে পারো যে I will tell about the lymph nodes when I describe the local examination findings, অথবা এখানে বলে যেতে পারো axillary lymph node কিরকম ছিল। যদি এখানে বলে যাও no need to tell it again when you describe the local examination findings. On examination of her breast, এখানে এসে local examination না বলে আমরা একবারে on examination of her breast বলে গেলাম। আর right breast is normal, একবারে যেহেতু আমরা normal breast করি তারপরে আমরা diseaseটাতে যাব। The left breast is larger than the right breast. The left nipple is a little bit higher than the right nipple and it is retracted. There is visible lump occupying the upper outer quadrant of our left breast, and there is skin dimpling over the swelling. এটা হলো হাত উঁচু করলে যখন dimpling হয়, that is the involvement of the Cooper's ligament, but there is no skin ulceration or purine change in the skin. Then palpation findings. On palpation, I found a lump in her left breast in the upper outer quadrant, 3 centimeter in size, and it is irregular in shape, firm in consistency, non-tender, neither fixed to the overlying skin, neither overlying not to the upper skin. Let's say it will be muscle, underlying muscle, and there is blood-stained discharge through one duct opening of the left nipple. এখানে এটা examination করে দেখতে হয়, nipple press করে যে আসে কিনা discharge, whether there is discharge or not. On examination of the axilla, no palpable lymph node is found in her right axilla, but in the left axilla there are 3 palpable lymph nodes. তোমরা এটা আমি একটা scenario দিলাম, but you will write down exactly what you find in your particular case in the exam. Anterior group, which is discrete, mobile, firm in consistency, non-tender. So these are the characters of the findings of the lymph nodes. There is no palpable lymph node found in the supraclavicular group on either side. Her liver is not palpable. There is no ascites or abdominal mass. There is no pleural effusion. Her breath sounds is normal. There is no adder sound. There is no bony tenderness over the spine, and other systemic examinations reveal no abnormality. এখানে in this particular case যারা ভালো করতে চাও তাহলে usually what the students write, other systemic examination reveal no abnormality, এটা না লিখে especially in case of post graduation you have to mention exactly what abnormality you actually look for. These are the lung metastases, these are the abdominal or peritoneal metastases, and then bony metastases. All these things we actually examine, and you have to specify if you want to get good marks. Next, so this is you have presented your case. After having presented or telling that salient feature, now the examiner will ask you what is your diagnosis. So এখানে straight away you go to the diagnosis, carcinoma left breast বলে তুমি বসে থাকো। এখন now the examiner may ask why it is carcinoma breast. So this is, as there is a lump in the breast, it is non-tender, irregular in shape, there is skin change, purine change in this, there is nipple retraction, and there is enlarged palpable lymph nodes. তাহলে এর পক্ষে যদি আমরা serially যাই, from the inspection there is a lump, there is skin dimpling, there is nipple retraction, and there is enlargement of the lymph nodes. এখন যদি in case of in your particular case if there is skin fixity or pectoral fixity, that will go in favor of your diagnosis. কাজেই আমরা এখন যদি বলি যে why it is carcinoma breast, as there is a lump, there is nipple retraction, there is skin dimpling and palpable lymph nodes. আর যদি additional findings তোমার পরীক্ষায় থাকে, then you mention those findings. What are the differential diagnosis of this condition? As this is a breast lump, so all the differential finding will come in case of in favor of breast lump. So if it is a malignant lump, you can say it is a benign lump. That means it may be a fibroadenoma or phyllodes tumor. I think air beshi don't need to write more than these two: the fibroadenoma breast and phyllodes tumor. Then if the examiner says why not benign these things, why you have mentioned this carcinoma, as there is skin dimpling, nipple retraction, and there is involvement of the lymph nodes or palpable lymph nodes. Then what you want to do now? এই কথাটা বললে I will investigate, এইভাবে lengthy question করতে যাবে না. Straight away you go, you tell that I will confirm my diagnosis by an ultrasound scan and by FNAC. By an ultrasound scan and by FNAC or TrueCut biopsy. এখন if you find a big hard lump with skin fixity, skin ulceration, ওই সমস্ত ক্ষেত্রে don't mention ultrasound or mammography. And when you can feel a big lump, when you can see that the lump is, when you can see that it is a hard lump, it is already fixed to the muscle or already fixed to the skin, or there is skin ulceration, then it will be a stupidity to send the patient for ultrasound scan or for mammography. Ultrasound আমরা তখনই করতে যাব if there is confusing lump or if there is confusion whether it is cystic or solid mass. Only in that case. কাজে এখানে যদি তুমি, if you can clearly palpate a lump and it is forming consistency irregular 3 cm, then no need to send for ultrasound. But যদি confusion হয় that maybe a cystic lump, then you can send for ultrasound. But if you find it is fixed to the muscle, it is fixed to the skin, hard lump and skin ulceration, then don't send for ultrasound or mammography. Now, so then ultrasound scan, I'll do an ultrasound scan and I'll do FNAC or TrueCut biopsy to confirm my diagnosis. Straight away, আমি কিভাবে কনফার্ম করব? Then examiner জিজ্ঞেস করতে পারে যে তুমি TrueCut prefer করবে? If you have got the facilities, that you will prefer TrueCut or you will prefer to go for a FNAC. আমরা definitely আমরা উত্তর দিব will prefer TrueCut. কেন TrueCut biopsy? I can take a core of tissue, I can do the grading of the tumor, I can see the invasion of the, you can see the invasion of the basement membrane, and we can do the receptor studies. So TrueCut biopsy definitely is better than FNAC. Then what is the stage the disease is? কাজে এখানে it is 3 cm size, so it is T2, and lymph nodes are discrete mobile lymph node, so N1. So far I have examined the patient, it is in T2 N1 M0. কাজে তোমার পরীক্ষায় যেটা পড়বে সেটার উপরে ডিপেন্ড করে you will tell the how will treat the patient. এখন এইখানে অথবা আসতে পারে তারপরে কোশ্চেন জিজ্ঞেস করতে পারে যে how do you confirm the stage of the disease? যে স্টেজিং করার জন্য আমরা কি করব? I will stage the disease by chest x-ray, by ultrasound of the abdomen, আগে যেটা বললাম in specimen, and a bone scan. So chest x-ray, abdominal ultrasound, and a bone scan to stage the disease. Then what are the treatment options? ঠিক আছে, আমরা গেলাম এখানে এক্সামিনেশনে এটুক বলার পরে অনেক সময় এক্সামিনার বলে যে তুমি এক্সামিন করে দেখাও একটু। So in that case, usually examination mainly the you show that skin fixity, or you show the pectoral fixity, or you examine the axillary or supraclavicular lymph nodes. এই কয়েকটা এক্সামিনেশনে করতে দেওয়া হয়। Sometimes কখনো abdominal palpation করতে দেয় যে you have said there is no abdominal mass and no Krokenbach tumor, or their liver is not palpable, just show me how do you palpate the liver. যে এইখানে এই লং কেসে, so far this particular long case is concerned, সেক্ষেত্রে তোমাকে এক্সামিন করতে দিবে যে either the fixity of the tumor দেখাইতে বলবে, palpable axillary and supraclavicular lymph node palpation করতে দিবে, অথবা বলতে পারে abdomen গিয়ে palpate the liver. So অথবা বলতে পারে যে স্কিন ডিম্পলিংটা দেখাও। এইটুকু পড়ার পরে এখন আসলো যে ট্রিটমেন্ট অপশনে যাবে। হোয়াট আর দ্য টিপিক্যাল কোয়েশ্চেন যেগুলো এই লং কেসে জিজ্ঞেস করা হয়। হোয়াট আর দ্য ট্রিটমেন্ট অপশনস? তাহলে তুমি বলবে যে ট্রিটমেন্ট সার্জারি, রেডিওথেরাপি, কেমোথেরাপি, হরমোন, যেটা আগে বলে আসছি। যদি বলে ফর দিস পার্টিকুলার পেশেন্ট যেখানে স্টেজ ইজ T2 N1 M0 and যদি ইনভেস্টিগেশনে যদি দেখা যায় ইট ইজ M0, দেন তুমি কি ট্রিটমেন্ট দিবে? তাহলে এই পেশেন্টটাতে টিউমার সাইজ ইজ লেস দেন 4 সেন্টিমিটার, ডেফিনেটলি পেশেন্ট বয়স কিন্তু কম, 42 years আমরা বলছি, and lymph nodes are also mobile and discrete. তাহলে we can easily do, তাহলে তুমি বলবে যে I can do a mastectomy with axillary clearance or I can do a breast conserving surgery and axillary clearance. For this particular patient, as the tumor is in the periphery, আমরা বলছি in the upper outer quadrant, as the tumor is less than 4 centimeters, 3 centimeters size, it is neither fixed to the spleen nor to the pectoral muscle, and the lymph nodes are mobile and discrete. So I can go for either breast conserving surgery or a mastectomy and axillary clearance. In that case, I'll discuss all the treatment options to the patient, and depending on the patient choice, I'll decide. এবং এটার ক্ষেত্রে মনে রাখবে যে এনি ম্যালিগনেন্সি ট্রিটমেন্ট করতে গেলে it should be a multidisciplinary approach. আমাদের দেশে আমরা করি না, but there should be a tumor board consisting of histopathologist, radiologist, surgeon, oncologist, breast and breast nurse, এই সবাইকে মিলে there should be tumor board, এবং এই multidisciplinary approach এ tumor board বসে ডিসিশন নেবে which treatment can be most appropriate for this patient, and then you offer the treatment options to the patient, and depending on the patient's choice you can go for a treatment. যেমন আমাদের দেশে একজন পাকিস্তানি সার্জন বলছিল, খালেদা ওসমানী, সে বলছিল যে our ladies are more concerned regarding the fate of their children if they die rather than their own relationship or their own beauty. সো এটা ওয়েস্টার্ন কান্ট্রিতে, আমাদের কান্ট্রিতে ট্রিটমেন্ট অপশন কতটুকু অ্যাভেলেবল আছে, ট্রিটমেন্ট পেশেন্ট কতটুকু নিতে পারবে, পেশেন্ট কিরকম ইন্টেলিজেন্ট, পেশেন্টের ফ্যামিলি কমপ্লিট করবে, মেইনি ফ্যাক্টরস উইল বি জড়িত। আর এখানে যদি বলে যে the options are either breast conserving surgery or mastectomy, and that will depend on many factors. এটা তোমাদের লেকচারে বেশিগুলো আমরা কনসেপ্ট পড়িয়েছেন, depending on all this patient's age, patient's family commitment, patient's intelligence, treatment, whether the treatment options are available, patient has got approach or access to the treatment, all the treatment options, এগুলো সবগুলো করে দেন। তাহলে কি করতে পারি? I can do a wide local excision or a quadrantectomy and axillary clearance, then followed by radiotherapy to the rest of the breast tissue, to the supraclavicular lymph node and to the internal mammary lymph node, followed by chemotherapy, and if estrogen receptor ERP are positive, then we'll go for tamoxifen, and if HER2 positive, then we'll go for Herceptin. So this much এইভাবে পরীক্ষাতে প্রসিড করবে। এখন তোমাকে এক্সামিনার ডিপেন্ডিং অন ইওর আনসার তখন তোমাকে ওইভাবে কোশ্চেন করতে পারে। এখন বলো যে তোমাদের এর মধ্যে কোশ্চেন আছে কিনা। এক্স্যাক্টলি এইভাবে কোশ্চেন জিজ্ঞেস করবে, whether it is in MBBS exam or in the FCPS exam or in the MRCS or FRCS exam. Question কিন্তু এই, these are the typical questions. এর মধ্যে কোনো কোশ্চেন আছে কিনা?
স্কিন ডিম্পলিংটা কিভাবে দেখাবো?
স্কিন ডিম্পলিং আমি আজকে প্রথম থেকে ভিডিওটা অফ করে রাখছি, আমি দেখাতে পারতাম। ask the patient to sit with her arms by the side of the body, and you stand or sit on the side of the patient lateral side. Then ask the patient to raise the arms over the head. Ask the patient to raise the arm and forearm over the head. যদি skin Cooper's ligament involved থাকবে, then you will see over the tumor there is dimpling of the skin. কাজে কি করবে? Patient প্রথমে বসবে with her arms by the side of the body. Then you sit on the side of the patient's bed and ask the patient to raise the arms over the head, and you look for any skin dimpling. ঠিক আছে? আর কোনো কোয়েশ্চেন? তাহলে এটা আসবে, how do you confirm your diagnosis? What are the investigation you want to do? What are the investigation you want to do to stage, or how do you stage the disease, and what are the treatment options? এটাই ডিসকাশনের মধ্যে আসবে। আর এক্সামিনেশনে they examine the lump and show us the fixity of the tumor to the skin or to the underlying muscle or pectoral muscle. সেই ক্ষেত্রে তোমরা জানো যে ask the patient to place her hands over the waist and to keep them relaxed, you feel the tumor, move it in two directions, horizontal and vertical. Then ask the patient to press hard over the waist and then feel the pectoral muscle, whether it is taut or not. Then again move the tumor in two directions perpendicular to each other. তাহলে first of all, ask the patient to place the hands over the waist and feel the pectoral muscle, whether it is relaxed or not. Then move the tumor. Then ask the patient to press hard over the waist and then feel the pectoral muscle again and then move the lump. In case of dimpling, ask the patient to raise the forearm and arm over the head. এই example এই বলতে পারে, and then after you may be asked to examine the axillary and supraclavicular lymph nodes. Usually we don't ask to examine the abdomen, but কোনো examiner হয়তো বলতে পারে just to examine the candidate that whether he or she can palpate the liver. বলতে পারে palpate the liver, show me how to see the ascites and show me whether the patient has got any lower abdominal mass or not. ঠিক আছে? আর ট্রিটমেন্ট অপশন নিয়ে কোনো কনফিউশন থাকলে জিজ্ঞেস করতে পারো। আর কোনো প্রশ্ন নাই? যে আমরা দুইটা জিনিস কভার করলাম, একটা হলো স্পেসিমেন আর একটা হলো লং কেস। এখন অনেক সময় জিজ্ঞেস করতে পারে তুমি এই পেশেন্টের এক্সামিনিং দ্য ডিউরিং এক্সামিনেশন অফ দিস পেশেন্ট, জেনারেল এক্সামিনেশনে হোয়াট ডু ইউ এক্সপেক্ট ইন দিস পেশেন্ট? যেটাতে একটা হলো যে লিম্ফ নোড এক্সামিনেশনে লিম্ফ নোড এনলার্জমেন্ট, আরেকটা হলো পেশেন্ট মে হ্যাভ জন্ডিস ইফ দ্য পেশেন্ট হ্যাজ মেটাস্টেসিস ইন দি লিভার। আর যদি anemia may be there, it's not that important, but if there are liver mets, patient may have jaundice. Any other question? Counseling station usually it is given in the auspice station counseling. Auspice station there is only one counseling station. ভাইভাতে usually জিজ্ঞেস করে না, বাট এটা তো অপশন তো থাকবেই। তুমি রোগীকে কিভাবে বোঝাবে, how do you counsel the patient? Usually these are asked in the postgraduate exam. Undergraduate সাধারণত কাউন্সিলিং জিজ্ঞেস করা হয় না, usually not.
Thank you, sir.
আর কোয়েশ্চেন? সিকোয়েন্সিয়ালি যদি আমরা যাই, প্রথম হলো হোয়াট ইজ ইউর ডায়াগনোসিস কোয়েশ্চেন করবে, দেন ডায়াগনোসিস স্ট্রেট অ্যাওয়ে বলবে রাইট ব্রেস্ট হাম্প পসিবলি ম্যালিগন্যান্সি, এরকম করে আনসার না, স্ট্রেট অ্যাওয়ে it is carcinoma left breast with axillary lymph node metastasis or carcinoma left breast clinically T2 N1 M0. Then what are the differential diagnosis? Maybe a benign tumor like a Pylor's tumor or fibroadenoma. Why you are calling it is a carcinoma? As there is nipple retraction, skin dimpling, and enlargement of the palpable lymph nodes. What you want to do now, I will confirm my diagnosis by an FNAC and two-cut biopsy or FNAC or two-cut biopsy of the tumor. And যদি মনে করো যে confusing lump, then ultrasound or mammography. What is the advantage of two-cut biopsy? I can take a big tissue, so we can do receptor study. We can do the grading of the tumor, and we can see the invasion in the basement membrane or surrounding tissue. And what is the stage it is in? It is in T2, N1, and M0. How will stage the disease? By investigation, chest X-ray, lung metastasis, abdominal, ultrasound, liver, peritoneal, and colon tumor, and bone scan to see the bone mets. And how to treat the patient? By surgery, radiotherapy, chemotherapy, and hormone therapy. Then surgery, I can do a mastectomy or a breast conserving surgery with axillary clearance. And about axilla, I can do a sentinel node biopsy, or as it is palpable lymph nodes, you will go for axillary dissection. And for chemotherapy, it may be in this case there is no scope for neoadjuvant chemotherapy, is because the lump is small in size. So the treatment will be chemotherapy is adjuvant chemotherapy after the surgery, and radiotherapy also adjuvant radiotherapy. If the lymph nodes are cleared, axillary lymph node, then to the supraclavicular and internal mammary lymph nodes. And if the breast conserving surgery is done, then a radiotherapy to the rest of the breast tissue. And about hormone therapy, if ERP are positive, then tamoxifen. If HER2 positive, then the Herceptin. And these are the treatment options and for this particular patient. Then examination may be asked to see the axillary lymph node palpation, supraclavicular lymph node palpation, fixity the skin, fixity to the pectoral muscle, and to see to show the skin development.
স্যার ব্রেস্ট সার্জারির পরে আমরা কতদিন পর্যন্ত রেডিওথেরাপি দিব বা কতদিন পর পর কতটা সাইকেল দেয়া যায় আইডিয়ালি?
Usually 5 gray or 5000 centigrade is the total dose. 5000 centigrade is the total dose. Usually জিজ্ঞেস করে না, যদি করে তাহলে একদিনে 200 গ্রেড বেশি দেওয়া যায় না, 150 to 200 গ্রেড দেয়। এবং এই জন্য উইকলি সাধারণত 5 days in a week, 2 days গ্যাপ, এইভাবে টোটাল ডোজটা হিসাব করা হয়। তাহলে 5000 সেন্টিগ্রেড আর 5 গ্রেড, হ্যাঁ, and 5000 সেন্টিগ্রেডকে ওইভাবে ভাগ করে একদিনে 150 থেকে 200। এটা আবার ডিপেন্ড করে পেশেন্টের বডি ওয়েটের উপরে, পেশেন্টের জেনারেল কন্ডিশনের উপরে দিয়ে ইউজুয়ালি জাস্ট। তাহলে এটা মনে রাখতে পারো, টোটাল ডেজ ডোজ ডাজ নট এক্সিড 5 গ্রে, এবং এখানে উইকলি 5 days in a week, 2 days গ্যাপ, দেন again 5 days in a week, এইভাবে দেওয়া হয় টোটাল ডোজ। আর কেমোথেরাপি ডিফারেন্ট অপশনস, ডিফারেন্ট রেজিম আছে, ইউজুয়ালি 6 to 8 সাইকেলস দেওয়া হয়। সিএমএফ আছে, এখন নতুন অনেকগুলো আসছে, তো কমন হলো সিএমএফ, সাইক্লোফাসফাইড, methotrexate and 5-fluorouracil. This is the common chemotherapy is given. Recently আরো অনেকগুলো অনেক চেঞ্জ চলে আসছে। তো সাইকেল দেওয়া হয় ইউজুয়ালি 6 to 8 সাইকেলস, এবং একটা সাইকেল 1 মাসে দেওয়া হয়, সম্ভবত 7 days ভর্তি দেখে, তারপরে 3 weeks গ্যাপ থাকে, আবার 7 days, দেন again 3 weeks গ্যাপ। আর কোনো কোয়েশ্চেন? ঠিক আছে, থ্যাংক ইউ ভেরি মাচ, আজকের জন্য আল্লাহ হাফিজ।